Okay, zoonoses now. Zoonoses now. What are zoonoses? Well, zoonoses are diseases, infections, bugs that can be transmitted across species boundaries, animals, and that includes humans. And in this context, we're going to be looking mostly at the transmission of bugs between non-human and human animals. Now, there are, in the case of these zoonotic infections, about 61% of human diseases have a potentially zoonotic origin. So there are lots of similarities with our species, and it's unsurprising that we might get diseases and be susceptible to some bugs that they carry. But for a lot of those animals, the pathogens they harbour are actually quite harmless to them. And it's interesting in some respects how dramatic these changes can be when a bug moves from one host, shall we say, through to a victim, in that for us we can get herpes virus very regularly on our lips and so on. It's a very minor irritation. But if a human puts that same virus into a gibbon, it's dead in 3 days. Now, 75% of global emerging human diseases have a link to wildlife. So we always have to be aware that things such as trade, especially international trade, in animals can easily affect humans. Now, there are about 200 of these zoonoses that we know of so far. We're learning more about them all the time. They follow the usual pattern of infectious agents, viruses, things such as avian influenza. There wasn't much in the way of human disease from avian influenza, but there were a number of cases. Bacteria, of course, such as salmonella, salmonellosis, many other bacteria. Parasites, worms, and a whole variety of these things that can cause problems in humans. Some of us, I know, I had scabies when I was a child. And fungal infections, dermatophytoses, ringworm, for instance. We'll see a nasty case of ringworm a little bit later on. And these weird little things are prions, which are kind of like proteins, and are very difficult to eradicate or kill. You can almost cook them, and they're still viable problems, and they're responsible for mad cow disease and VCJD in humans. Now, of the 200 or so zoonoses that we have, about 70 of them are associated with the species commonly found in zoos, petting zoos, and the pet trade. And for instance, about 40 of these zoonoses are associated just with reptiles. There are a whole gamut of ways in which one can pick up a potential zoonotic infection. We generally categorize them as direct or indirect. Direct, for instance, is the usual fecal-oral route. That's a case of touching something that has the bacteria on it, whether that's the animal or its environment, or even a door handle that someone has touched, having touched the animal and so on, and then you put that in your mouth and you ingest the bugs, and you could get sick. Not many people realize that you can actually pick up a zoonosis through your eye. It doesn't have to be a disease that affects your eye, although it could be, but they can also simply get down through the plumbing around your eye and then into your body. Same thing with the ear, the little tubes down the back of our ears that bugs can get in. Transdermal means going through the skin. Now, our skin's a wonderful barrier to infection. It really is remarkable. But if you put holes in it, scratch the surface of it, then these bugs can get in. And things like animal claws, for instance, doesn't have to be a big bite. Something like an animal claw can also just scratch the surface and introduce the bugs, and then they can get into your system. And then we have what's called fomite category, which is to say it's just the stuff that sits on tabletops and anywhere else, and then you might well just come into contact with it, completely unaware of the fact that it was there. How would you know? It's not like it's got a flag on it. Then there's aerosolization, which is to say droplets of moisture in the air. The bugs can get in and essentially be transferred around the environment, then we can inhale them, ingest them, and so on. And finally, probably one of the most unlucky devils will be somebody who gets a zoonosis from a blood transfusion. They've gone in to have help for something, and they come out with something they really didn't need at all. But it happens. Even things such as reptile-associated salmonellosis, people have acquired through blood transfusions. Now the signs and symptoms are two different things. Signs are what your doctor sees in you, or the vet sees with the dog or the cat or the reptile, and the symptoms are what the person feels. So you might feel sick, that's a symptom. The sign for the doctor will be high fever, the vomit all over the floor. That'll be a pretty good indicator. But the signs and symptoms of zoonoses are remarkably similar to many of the diseases that we're so familiar with in everyday life. So one of these categories is what we generally regard as the gastrointestinal set. Stomach cramps, nausea, vomiting, we've all had it. We've all had it. But whether we had it from the reptile-related salmonellosis or from touching an amphibian or something from the bird, or did you get it from the curry, is very hard for us to know at the time. Another category is the flu-like set. High fever, malaise, and so on, coughs. And again, these are things that we see and experience from childhood along. And they could also be zoonotic infections that we have. In the case of this woman here, either she's noticed that she has a very high fever or she's discovered she's pregnant. Either way, it looks bad, but at least the fever doesn't last for 18 years and demand you buy the car, does it? I mean, ringworm. Simple little ringworm that you would normally just get a little patch of on your skin can actually turn into a much more serious disease. It goes systemic as well and require a lot of hefty treatment to try and clear. But again, these are the dermal sets, and so you can see pretty plainly that there's a wide variety of zoonotic infections that can manifest in everyday ways. And this creates a problem because it's difficult to differentiate. Because they resemble these diseases, these common diseases, it's often difficult to differentiate a zoonotic infection or infestation from an everyday problem. And even when you go to your GP or a physician, as you say over here, they won't necessarily ask you, some will, but most probably won't necessarily ask you, do you have a reptile in the home? Do you have a bird in the home? And they will treat you the way they would treat everybody else. Unfortunately, most of the time, that standard treatment is going to work perfectly well. Not always, but most of the time. And so we don't really get a very good handle on the frequency of zoonoses. And it does mean that if someone visits a reptile show or a circus or a zoo and happens to pick up a zoonosis, it may well be that they're never connected with the disease. So that's what we call a deferred association. And these diseases are being masked in the general population. Now, we know a lot about zoonoses. We know an awful lot about some. We know a lot about diseases such as rabies, and we know a lot about diseases such as reptile-related salmonellosis. And they're almost at two ends of the spectrum. If you get rabies, you die. That's it. If you get salmonellosis from a reptile, you're almost certainly going to live. Not everybody does, but almost certainly you will live. But the thing about salmonellosis is it's a very widespread problem. And you may well have gone through your entire lives being, I'm told I can say this word, you may well have gone through your entire lives, or almost, being fully in control of your asses. No, seriously. You tell your ass where to sit, when it can go out, what it's going to wear that day. You tell it, and then you get salmonellosis. And suddenly, this is an ass that realizes its time has come. Right? If you had salmonella infection, you know exactly what I mean. It will tell you what you're going to wear. It will tell you if you're going out and how far. Right? Public transport is out of the question. Right? You may not leave the bathroom, and dating is an absolute no-no. Right? But for the zoonoses sitting in the middle, we don't know a huge amount about them. And one of the reasons we don't know a huge amount about them is precisely because of this peculiar middle ground where we have the deferred associations and we can't get enough data on their prevalence. But if you take salmonellosis, for instance, it's one of those we know quite a bit about. And given that there is a distinct reptile theme here, I'm going to dwell on reptiles. So if you take baby turtles, for instance, well, baby turtles were once sold in Canada right through to the mid-70s, you'll probably know that. And then in the US, it was discovered that about 14% of all salmonellosis infections, that means it includes food, environment, contaminants in general, about 14% of those salmonella infections in Americans was due to pet baby turtles in the home. So the United States banned that, the keeping of baby turtles in 1975, and Canada followed suit in 1976. And the following year, just to emphasize how correct we all were, I say we, I was only about 12 then, but how correct it was, there was a 77% drop in cases the following year because of a ban. And that shows you just how effective bans can be when you implement them. Right now, there are approximately 70,000, just over, cases of reptile-related salmonellosis every year in the United States. Not so much from baby turtles anymore, although there are still some turtles in circulation, but from snake and lizard keeping in particular. Now with lizards, for instance, we handle lizards more than we would a typical turtle, and lizards are capable of scratching our skin and therefore introducing salmonella that way. Snakes don't have the claws, but we tend to handle them a lot more. So there's a debate as to which of these sources is perhaps most important, but also it's definitely known that they are important. And in the UK, where we have just a fraction of the size of the trade, it's a smaller country, we still have about 6,000 cases of reptile-related salmonellosis every year. And this is a particularly disturbing statistic down here. Hospitals in the southwest of England surveyed the kind of infections they were getting, the kind of salmonella-type infections they were getting, and they found that of hospitalized children under 5, 27%, more than a quarter, of all those hospitalized with salmonella infections picked it up from their pet reptiles. But it's not just salmonella, these are just a couple of the other bugs that are increasingly being found associated with zoonotic infections in humans coming from reptiles, Campylobacter and botulism. Now the problem is not abating. In my next presentation, I'll be talking about some of the measures that are out there to try and control this, try and moderate the problem. But basically, it doesn't work, it's a short message. The issue is getting bigger, the problems are getting bigger. Adding to the issue of direct infections, we have antibiotic resistance. Antibiotic resistance is where we've had overuse of chemicals to try and control bacteria, and the bacteria then push back, to put it simply. And the chemicals don't really work very well anymore. Ironically, physicians, nurses, veterinarians are being berated sometimes and given recommendations to cut back on their antibiotics, while the fish industry, for instance, the pet fish industry, applies tons of antibiotics into the water for the fish they ship just to try and curtail the deaths from acute infections. This last thing is a relatively new issue. It's not an infection as such, but it was a big selling point for reptiles where the trade would say, oh, get a reptile, it doesn't have fur or feathers, it's good because you won't get an allergic reaction to it, really. It's now known that the crickets that many of these animals eat contain a lot of allergens, and of course they defecate out the remains of the crickets, etc., and then that gets gradually spread over the environment and the animal, and you pick up the allergies that way. And so, if you remember back to the first presentation and the way in which wildlife of all different species are being mixed in all different sorts of ways, you can quickly see that we have a very diverse reservoir of bugs out there. Many of them don't cause a problem, but many of them do. And we have these accumulations of potentially problematic bugs in all sorts of hubs, whether they're export hubs, import hubs, distribution centers, people's homes, reptile shows, zoos, circuses, petting events. They're there. Getting to the origins, trying to trace back the sources is a nightmare for the reasons I mentioned to you before. It's all been masked away in the complex supply chain. And one of the things that's now starting to concern people is the possibility of new viruses coming about. Could be pretty bad. May not be, hopefully not. It's being discussed. And if you're thinking, well, maybe only one snake in so many, or one lizard in so many, or one turtle in so many might have a bunch of salmonella in it, you'd probably be mistaken. So we sampled 9 snakes. They all had salmonella and a variety of other little pests that can affect humans. And something like 90 to 95% of all reptiles across the board that are sampled are harboring salmonella. And chances are it's higher than that because you get false negatives. And the volume of scientific literature about the zoonotic issues, not just salmonella, across the board, zoonotic issues, whether they're for reptiles or amphibians or anything else, is growing by the month. Just go do your searches online, you'll see. It's a big issue. And it's unsurprising that it's getting a big issue, given the opportunities. If someone happens to visit this is a reptile show in maybe Spain or Germany, I'm not sure, and you have them here. You visit these events, you don't know the source of those animals. People are allowed to just handle almost anything. You think that little bit of alcohol gel is going to last you all day, protect you all day? No. There's also the routes of transmission I was talking about earlier on. Think about it. Even if you wash your hands, you handled the animal's been on your clothes, you then go back outside, you touch your clothes with your newly cleaned hands, you get some more bugs on you. You then go and handle the baby, put your hand near its mouth. Not good. And because of this sort of discrete transition of bugs into society, 2 completely separate pieces of work, I was involved with one and this was another, same year, came to the same conclusion, completely by chance, that exotic pets are the new Trojan horse. We invite them and thereby their bugs into our homes, completely unaware of what they're carrying. Kind of done that. I've kind of done that. But this is interesting. So when sampling was done on antibiotic resistance in fish in one study, this one here, sampling 32 freshwater fish, different species, 77% of those sampled had this antibiotic in them. That's how prevalent the antibiotic is in these animals. It's a recipe for problems further down the road. And as you can see, it's something that's attracting concern. And these are not fanatics, these are not silly people, these are not people with a vested interest, these are epidemiologists, people whose job it is to just find out what's wrong. And as you can see, just a small snippet of the literature that's out there and growing by the month on this issue alone. Here's another problem. It's the messaging that you see from the industry. The pet industry does not want to turn around and say, look, if you buy this animal, you could get sick. And the last thing you want to do is allow your child to kiss it. No, they want to make it sound very friendly and nice. And so messages and images such as this, they're very cute. It's lovely. I mean, it's very nice, isn't it? But it's irresponsible messaging. And so is this. This is actually in Canada, down over in Newmarket. Now, the facility itself, I mentioned it earlier on, the facility itself, as far as captive facilities go, I'd say it's not a bad facility. It's better than most, in my opinion. But this sort of messaging is completely irresponsible. Almost all guidance you'll see anywhere, which is weak, by the way, but almost all guidance you'll see anywhere will still say, don't let children under 5 near a reptile. I don't think she's even 5, but I could be wrong, but I doubt it. So this is how I think of it. Yes, it's facetious and mischievous, but it's also true. Soft toy. Now, it has no sharp edges. We bought it from Toys R Us, I think. Very nice little toy, nothing wrong with it. So the parts are stitched in, the eyes are stitched in so well that they can't be plucked out and swallowed or choked on by a child. Very sensible, very responsible. It's fire resistant, so if the entire house burns down, you still have something to hug, comfort you when you've lost it all. It has ID labels stitched in. You can see them here. That gives you the details of the manufacturers and certain tests that it had to pass to show that it was safe to be in the public domain. Now compare that with the real live turtles. They do bite and they do scratch. So unlike this, that's all nice and soft and comfortable and harmless, these are not. Unlike this, these guys can be very easily harmed and frequently are. You cannot eradicate salmonella and a whole raft of other bugs from turtles. It can't happen. The pet industry tried to do it for about 40 years and gave up. It's impossible. It's part of their normal intestinal flora. You can't get rid of it. So they're impossible to clean, and they're almost certainly going to be a source of infection in the household. And it's almost impossible to care for them well. One of the typical things we find is that people say, I'm looking after an animal well. If you think you're looking after a reptile well, you're probably doing something wrong, because it's very hard to do it well. And finally, if this product, because technically it is a product, technically, if this product had ID labels in it, it would be saying this is an unsafe product. Don't buy it. And yet this has the protections of law, and the consumer has the protections of law from it. Not so on either front with this. I won't dwell too much on this because we've kind of covered it, but hand washing is one of the standard pieces of advice for almost anybody when it comes to handling reptiles, well, just domestically around the house. But if you're trying to protect yourself, and that's the impression given by pet traders, reptile show managers, and all sorts of people, wash your hands. Sensible, very sensible, but it's not enough. It's just not enough. Surgeons wash their hands, veterinarians wash their hands. They do so very thoroughly. They use very good chemicals, and they're very conscientious about it. They also know exactly what the risks are. Not all of that can be applied to everybody. And in fact, even where it does apply to surgeons, and they do this conscientiously, you still have something like a 5 to 10% infection rate in hospitals because of problems of trying to maintain such a high level of hygiene. So if the surgeons can't do it, it's no use telling people you are safe by washing your hands. You're not safe. Maybe better protected, but you're not safe. So we say do not rely on hand washing. You have to presume that the entire environment in which a reptile or another exotic pet is could be contaminated. The entire environment, from the door handles to the cage and what's inside it. You have to take responsibility not just for yourselves, whether you're somebody who works in a shelter and you're trying your best to pick up the pieces of the trade, or whether you're somebody who works in the trade selling these animals, or you just keep them. You must also think about the wider environment and society, because in the UK, for instance, we've had several deaths from reptile-related salmonellosis. And they have all come through secondary contact. People didn't have a turtle or a snake. At least 2 out of them didn't have a turtle or a snake. Somebody came to their home and left their home, touched the hoover, and then that person innocently touches the hoover and picks up the infection. So you have to be mindful of others if you have these animals. So our advice to everybody essentially is, if you really want to be in a position to avoid zoonoses, don't get an exotic pet. That's it. Any questions? You got a question? You got a question? No. Questions? Jean-Luc?
How do these compare to zoonoses that people get from, say, dogs or cats? Is there a higher proportion amongst exotic pets?
Proportion, it's an excellent question. I should have actually put answers to that in there. The way you have to think about the domesticated animals such as dog and cat zoonoses, of which there are quite a number, yes. And the exotic side is that most veterinarians are very familiar with domesticated pet zoonoses. If you've been to almost any veterinarian and you happen to have several cats, they will probably ask you whether or not there's an imminent pregnancy in the household. They will know about that because there's a nasty association between some cats and pregnant women getting sick and the babies. When it comes to exotic animals, the familiarity with the raft of zoonoses that are involved is nowhere near as good. So whilst you may well have statistically more incidental zoonoses emerging from domesticated animals, they're actually caught so much more quickly, and they usually don't proliferate in the same way that exotics do.